Welcome to a new episode of our Pets video series. Today we're going to talk about the diet of senior and geriatric dogs. As pet parents, we all know that it's very important to feed our dogs an appropriate diet, which meets their dietary needs. So, Dr. Shiad will talk to us today about the diet of geriatric dogs. So, the first question, Dr. Shiad, is when is a dog considered actually senior or geriatric?
Yeah, that's a very good question actually. Like, see, there is no hard and fast rule as such, but because it varies with the breed, the size of the dog. So again, the condition where the dog lives, all those things are very important. So depending on that, we have to decide. For example, like size of the dog, if you take, so a Great Dane would be considered, large breed. So which will be considered like a senior dog by even by 6 to 7 years only. Yeah, after 7 years he is considered a senior dog. But same time, if you compare it with a Chihuahua, so they're like after 9 or 10 years they are considered senior dog. That's based on the size. So because the smaller you go, they live longer, and also and same with the diet and all those things. It changes according to their seniority. So that is based on the size and breed. So I think that should be the main thing. Like in India, if you consider like it's mainly the medium breeds which are popular. So you can take is like labs are quite popular, lab retrievers. So for them, it is generally like after 8 years you consider them as 8 years they are considered senior dogs.
So, Dr. Shiad, just how is a senior dog's diet different from an adult dog or a puppy?
Yeah.
And
so,
why?
See, as age increases, there are a lot of issues, as I said. So, like, it's not always the same. Like, the energy requirement changes with the seniority. And also, a senior dogs, it is like you have to keep them on a lighter side. That's also important. So, as I said, they get dental issues, which will make which will make them like basically it will be problematic for them to chew and all. So, so accordingly, you need to change the food. And their adult dogs, like senior dogs, are generally less active, so you need to cut down the calories. Otherwise, they put on weight again, which will cause problem on the joints. Slower. And they also tend to get like they can't pass motions because of the low constipation. All those things can happen. So you need to increase the fiber accordingly. So that way you need to adjust the food.
So, then what should dog owners watch out for in a senior dog's diet?
So as I said, like first thing, like the calorie has to be cut down according, because generally with the seniority, they become less active, they don't walk around, they don't run around much. So calorie has to be brought down. And also like they are prone for a lot of renal issues and other age related problems. So like they need to include some of the multivitamins and other things into the food as well. As a supplements. Also the joint supplements, which are important because with age they tend to get knee problems, joint problems and all. So which need to be supplemented extra through the food as well. And as I said, also like the chewing part also you need to be taken care of. It has to be soft, and the kibble size has to be
the hard
small.
kibbles might not be such a good idea for a senior dog. Okay, so then in this case, what should the diet consist of for a senior dog?
For a senior dog, if you see like in nowadays there are commercial diets which are available, which are quite easy to pick up, and a vet can easily guide you what amount and things can be given according to your dog's size and things. So that is with the commercial diet. And generally commercial diets, they have all the supplements and like everything added to the food. Yeah, added to the food. So you need not supplement it separately. There are prescription diets which are available. Yeah, yeah, that can be used. Otherwise, if you want to go for home food, what you can do is you need to really increase the fiber content. That's very important. Yeah, fiber content should be minimum 5%, or even more. It can be kept even more, because that will help in bowel movement as well as to cut down the calories. So, as I said, I can no harm. You can go with the home food. No harm. But only thing is, you need to supplement few things.
Okay, so if we stick to home food, we have to give supplements.
Yeah, definitely, we'll have to go for supplements.
And in terms of percentage, would be like
Yeah,
lower,
lower calorie,
lower
yeah,
calorie, lower
and
carbs,
yeah,
probably,
yes,
and more
and
fibers.
more of fibers.
Okay. It's pretty common for senior and geriatric dogs to stop eating or refuse food, at least for some periods of time.
Yeah, definitely.
So what should pet owners do in this case?
See, first thing what you know, like most of the time what they notice is like, so the dog will become choosy. That's one thing which owners generally say, like, okay, my dog drinks milk but not eat the kibbles. So there, it shows that there is some mechanical issue that could be the tooth dentition, where he or she may be not able to chew properly. So you need to really consider that. So there, like generally you can correct it by like making the food softer. So it can be, even the kibbles can be given, but only thing is, softened. Either you can add lukewarm water and make it soft and then give. Otherwise, some dogs which are okay with milk, you can add milk to it. That way it becomes soft. They also like the taste then. And the kibble size, there are like senior dogs kibble sizes which are very smaller and easy to chew, softer also. So those commercial diets, if you're going for, you can select those foods which are softer. And the kibble size will be small.
And if the dog refuses food altogether, what
completely, if they refuse, definitely you need to attend. So it can be like not just the mechanical issue, as I said, but it could be something like underlying disease. It can be, and also because senior dogs are prone for like renal problems, it can be the initial signs of a renal problem. So, immediately, it's better to get your dog checked, because senior dogs, it's all of a sudden things can go very bad because of these things.
So, Dr. Shad, we need to wait for other signs to come up before taking the doctor to the dog
first
to the
thing,
vet?
as I said, if it is just a mechanical issue, you can solve it at home itself. But if it's beyond that, it's better to get it checked.
So if the dog refuses food for a whole day or 2 days, we should definitely take it straight to the vet. And you mentioned earlier that supplements should be given because senior dogs and geriatric dogs have joint problems, hip problems. Can you elaborate more, like what supplements exactly can we?
See, important thing is they need all multivitamins, because with home food generally they tend to get like deficiency. So it is very important that you include all these multivitamins into the food. So like either it can be mixed with the food, and nowadays there are a lot of like over the table, like there you can get all multivitamin tablets which can be included. But apart from multivitamins, important thing is joint supplements. Which are very important, because senior dogs, because of arthritis, they tend to get arthritis. So you can add these joint supplements into the food, or either supplement it directly, or which can help the joints. So that is also important. And also, like if it is a home food, you can include like normal oils also, like even like a wheat germ oil, coconut oil. Any of these can be, like raw oils can be added into the food as well. And as I said, fiber is also important. Along with that, you have to add these things, which would make you which would be good for the pet.
Dr. Shad, one last question, because I've noticed that Indians are very particular about food, and even when it comes to their pets. So they tend to actually overfeed the pets. What about in the case of a senior dog or a geriatric dog? How many times a day they should be fed?
For senior dogs, it's like it's more than the quantity. Like you have to increase the frequency of feeding. And smaller quantity.
So we reduce the quantity.
Yeah, like
only increase
yeah,
the
increase their frequency.
Okay.
So that way you can manage a little bit. And another thing is because their digestion is weak, so they can't
Okay.
digest well.
Okay.
Also, I think I forgot to add one thing to in the previous question, that was the supplements.
Supplements.
Yeah. So there are, like, because they are prone for kidney problems.
Okay.
So like there are some like binders, like phosphorus binders,
Okay.
which can be added to the food, which can like basically prevent the kidney damages, because phosphorus can really damage the kidneys of the older dogs. So these also can be added. Yeah. So I'll come to this now. So now, as you said, owners, they tend to, like I say, like they keep giving food, and they don't control the calories. Then they put on weight, which in turn cause joint problems. So where you need to like really work on the calories and cut down the calories and increase the fibers. As I said earlier, you have to make these adjustments for the generally when a dog comes to the clinic, so looking at the dog, we can know the status of the owner as well. If I'm getting a very obese dog, definitely that the owner also will be obese.
we'll have some more
This correlation we have seen it many a times. Yeah.
So in terms of quantity, so we should reduce the quantity. The quantity should be less.
Yeah. Quantity should be less and increase
and maybe
the frequency.
feed them like give it like 2-3 times a day.
Yes.
For a senior dog.
Senior dog. Even 4 times you can feed, because it depends on each dog actually.
Okay.
Yeah.
But should we never leave like food out there for them or kibbles or just to have them whenever they want?
No, better not to.
Better not to.
Yeah.
Okay, Dr. Shia, thank you so much for
Thank
being
you.
here today with us. Thank you for watching our episode, and we'll come back with a new episode of our Video Pet series next week.